Coming up next on The Voice of Alabama Politics, our guest today is Dr. Don Williamson, State Public Health Officer. Also, the V-Team takes a look at unfinished business at the State House. And there's a new website called Hubbard Exposed. No, he's not naked, just the bare facts. All this and much, much more coming up next on The V. Welcome to The Voice of Alabama Politics, where we tackle the tough issues so you have the hard facts. My name's Bill Britt. I'm your host, and I'm joined as always by the V-Team. Welcome all.
Good morning.
A lot of big issues left undone at the State House. One of the biggest are the budgets. We have not yet passed a budget, the only thing the legislators are constitutionally responsible to do.
Well, they've passed them. We're just in conference committees and negotiation and lingo.
Yeah, well, that's true.
One of the biggest things that we've seen in the Education Trust Fund budget is that there's a $28 million difference between the House version and the Senate version. So when they come back from spring break this next week, that's one of the first things that they're going to have to do in conference is figure out how to resolve that big difference. And about 19 million of it is in the K through 12 foundation program.
How does that work out? The governor asked for a 2% raise for teachers. The Senate put in a one-time bonus, and then the House says no go.
Well, they go to conference committee, and they met the week before we got out of spring break, and I think there's been some negotiation going on, I understand, the past week. And, of course, we'll come back into session tomorrow, Tuesday. And I'm assuming the governor put an executive amendment on it, and then we'll see if the governor and his troops have the ability to let them not override the budget.
Well, I mean, it's a big gap here, isn't there?
It's a fairly substantial gap when you talk about $28 million.
Well, one of the big things that's being lost in this whole issue is we talk about the education budget and just numbers, $28 million here, $5.8 billion there. We've lost the morality and the values of government. What is it government should be doing? What is it they shouldn't be doing? Are they getting into things they shouldn't be doing? And are they forgetting to pay attention to things they should be doing? If you go back and look at state employees and teachers, they're making less money in real dollars than they were 5, 6, 7 years ago. To me, that's immoral. You're asking people to sacrifice their lives on behalf of service to the state, whether they're state employees or a teacher, and you can't give them some sort of cost of living increase over time. You're taking more money out of their insurance premiums, and we're talking not just 1 or 2 years, 6, 7, 8 years this is going on. It's too much.
Well, it's a fine balance, because a lot of people think they have job security, they have a job, and they're out of people. They're here, that people that don't have jobs, unemployment. But there was a national thing that the national governors did, and we're bragging in Alabama. I think Alabama and 2 other states that have shrunk government more than any state in the United States of America. But what they've done, as you've mentioned, Barron, is they have shrunk government on the back of state employees and the educating employees and their
Well, I mean,
programs.
shrinking the size of government does not mean limiting government. That's the problem. People want limited government, not
fewer employees.
Not fewer
and go back to this employee issue. Something Claire just said is startling. I saw a study the other day that compared Alabama with a few other states. We have fewer people employed than we did in December of 2010 when the stealing the State House or storming the State House took over.
Right.
Sorry.
Whatever.
But in December of 2010, we had, I think, 10 or 12,000 more people employed than we do now.
That
was the height of the recession. Texas, in contrast, has 900,000 more employees. So it's not.
Well, why is this? Why is the job growth going in the wrong direction?
Well, they want to say that they have, they want to say since we came in 2010 as Republicans, we have cut the fat in state government. What they've done is cut the state employees. They've cut jobs. Are we really even carrying on the essential services of state government? And you would have to wonder that For an example, when you're a military person, you go to the probate judge office and you can't get done what you need done in the 3 days you're in town because they're closed 2 other days.
Right, right. Well, they want to give the state workers, what, a $400 bonus? I mean, really, by the end of the day, that just washes out to be
That's kind of
pennies.
embarrassing, quite frankly.
Yeah. I mean, and it's election year. You'd think they want to get something done.
It's frankly quite surprising that they aren't trying to do more when it comes to the cost of living increase for state employees and the bonuses for the teachers for that very reason. I mean, those are 2 rather substantial voting blocks.
Well,
when
I
you're
must
talking
say,
about
I've
an election
personally
year.
talked to the governor, and the governor has put his feet or his heels in the sand, and he said in the last 2 weeks, I'm actually going to fully fund PHIP. I'm going to request for the 2% for the teachers and, give money to the state
And PHIP
employees.
being the teachers' insurance program.
Yes, right. So we'll see who wins the battle, David or Goliath, but I think that the governor's been pretty strong with this, and I hope he wins for the state employees and for the teachers. They deserve this.
And the Education Trust Fund budget is not only not the only budget that the state is having to look at when they come back from spring break. The other one is the general fund budget. One of the things that I noticed when I was combing through the LFO report was that there's a $70 million increase for the state Medicaid agency, and that's a pretty substantial jump. The other thing that is a big consumer of the general fund budget is the prisons. And with all of the things that have been going on with Tutwiler and all of the 58 or 63 or whatever point plan that the governor wanted to put into place and the Department of Corrections wanted to put into place, we're only talking about a $6.8 million, it's actually a $6.8 million cut. In corrections. So I'm not really sure how they're going to fund this increase in services, this increase in equipment that they need when they're decreasing that portion of the budget.
Well, it's hard to imagine that we're not going to get a federal takeover of our prisons unless they do something.
Yeah, but Dr. Williams is a guest later on this morning, I believe.
Yes.
And what a lot of people may not understand sitting out there in your dens this morning watching us is that when it comes to the Medicaid money, we have to have X amount of dollars from the state to get the federal matching money, and that's critical because a state like Alabama, we may send in $1 to the federal government, but we get $1.75 back from the federal government. So it's critical that we send the right money and that we don't shortchange the federal government.
Well, one of the bills that's still pending is Scott Beason's gun bill, where he wants to make it legal to carry a loaded firearm in your vehicle without a permit. I don't necessarily have a problem with that. The sheriffs do. We've got about 1 minute. Charlana, what's your thoughts?
One of my biggest complaints is that I took a look at the statistics, and it looks like there are in excess of 350,000 concealed carry licenses that are issued in the state of Alabama. When you talk about not requiring the concealed carry license, you're cutting money from those sheriff's departments, and the sheriff's departments use those funds to pay for things like equipment, bulletproof vests, training, computers, other kinds of services, and those are funds that you're essentially taking away from.
And one of the nice things about requiring people to be permitted is the sheriff or the state trooper knows when they approach the car that person may be armed. If you don't have the permitting process, you've got people pulling over on the side of the road late at night, walking up to a car, they don't know if there's a gun in there or not.
Well, I agree with what y'all are saying, but it's an election year. We're in Alabama, and people like to tote their guns. They like to pack the heat, and this has always been positive, and people want the endorsement by the NRA, and I think Georgia, I read just last week, is looking at this same measure as well.
Well, it's controversial. So is Beason. You're watching The V. Our guest, Dr. Williamson, the state health officer, is coming up next.
Did you like that segment?
Take the 1-9.
The V is sponsored by Spot On Strategies Group.
I make sure to get your kids to school and home safe every day. I am AEA.
I make sure your child receives a healthy meal each day. I am AEA.
Thank you, AEA, for protecting our public schools and our futures. We are AEA.
Welcome back to The V, the voice of Alabama politics. Our guest today is Dr. Don Williamson, Public Health Officer for the state of Alabama. Welcome, Dr. Williamson.
Thank you, Bill. Glad to be here.
You have a big job being the Public Health Officer, but you also have another job that you didn't ask for, but the governor asked you to do it, and you've done a remarkable job, and that's watching over the state's Medicaid program. You're one of the few people that we know that can handle two state jobs and do it well.
Well, that's kind. It's been a privilege to try to hopefully make a difference in Medicaid. There's a lot still to be done, but I do think we have made progress over the last couple of years.
Well, Medicaid is something that we hear a lot of talk about, both negatively and positively. Over the last couple of years, the legislature, the governor, and yourself have been involved in sort of revamping Medicaid for our state. Could you tell us a little bit about Medicaid itself, how it works, and then let's explore the new changes that are coming?
Well, I think to a lot of people, Medicaid is simply a black hole that consumes money out of the general fund. And I have to say, when 2 years ago the governor asked me to do this, I went into Medicaid with an assumption that I knew how to fix it. It would be fairly simple. What I found, as in most things in life, the more you learn about it, the less you find you actually knew about it. Medicaid is an extremely important program for our citizens. It covers 47% of all the children in the state. It pays for over 50% of all the births, and over 2/3 of the people in nursing home in Alabama are paid for by Medicaid. Now, most people see Medicaid expenditures as having grown dramatically over the last 5 years. In fact, if you look in 2008, what you find is that Medicaid in 2008 consumed almost $500 million state dollars. In 2014, it consumed $615 million state dollars, and in 2015, almost $700 million state dollars. The question is, why that increase? Well, if you go back to 2008, you find that from about 2003 to 2008, we averaged about 750,000 people per year on Medicaid. Beginning with the Great Recession in 2008, from 2008 to 2012, we added 200,000 people to the Medicaid rolls. So that's the first major driver for increased Medicaid cost. The second big driver for increased Medicaid cost is something over which we have absolutely no control. It's the federal matching rate. Medicaid is basically a contract. It's a contract between the state of Alabama and the federal government, and the federal government says, we will give you $2 for every $1 that you put up. That's our historic matching rate. But during the Great Recession, in 2009, 2010, 2011, the federal government came in and said, because the state economies are in such bad shape, we're going to give you $3 for every $1 you put up. So in 2010, the federal share went down to $300 million. But now we're back at $2 federal for every $1 state. So it's this changing in the federal matching rate and this growth in the number of people who are enrolled. I think the other big thing that's important for people to understand about Medicaid is Alabama has one of the most constrained Medicaid programs in the country. We provide service to only those people that the federal government tells us we must provide coverage to. Our reimbursement rates to physicians and dentists are among the lowest in the country. We don't provide optional services, and we don't provide services to people that we don't have to cover. So it's a very minimal program, but it's a critically important infrastructure for health care throughout the state.
Now, men are not covered under Medicaid at all, is that correct?
Well, when I first years ago got into public health, my assumption was Medicaid was largely a program for poor people, and if anyone who was poor could get on Medicaid. That's simply not true. If you're a childless adult, whether you're a woman or a man, if you're a childless adult and if you're a woman, you're not pregnant and you're not disabled, you cannot qualify for Medicaid irrespective of your income. For parents whose children qualify for Medicaid, those parents, mom and dad, only qualify if their income is at about 12% of the federal poverty level. So there's really not a way, say, for the 45-year-old non-disabled diabetic adult man in Alabama to qualify for Medicaid. And for many women in Alabama, the only way they can qualify for Medicaid is to become pregnant. So years ago, the state got permission from the federal government to provide family planning services to women to prevent them from becoming pregnant in lieu of only covering them when they got pregnant. It saved us tens of millions of dollars every year to do that.
One of the things this legislative body has tried to do is rein in the cost of Medicaid while providing better services. Easier said than done, but there are some ways that you're working with them to make this happen. Could you tell us about how that comes about?
One of the things when I started this, I thought there was a simple solution, and that was just going to be to use commercial managed care. I quickly found out Alabama is the only state in the country where none of our hospital cost is paid for by the general taxpayers of Alabama. It's all funded by the hospitals of Alabama. So a $2 billion program, our hospital program, gets no state money. So when you start trying to say, okay, how are we going to reduce costs, the obvious ways that other states have found to reduce costs, reducing hospitalization, doesn't work so well. So we had to look at alternatives. And one of the things that we're looking at now is managed care, but homegrown, using doctors and hospitals and other providers in Alabama to manage the care, with the idea being really twofold. Number one, you will, instead of paying for every visit and every time you go to the emergency room, every time you go to the hospital, we will figure out how much we pay per beneficiary per year, and we'll pay that to what we call a regional care organization on what's called a capitated basis. So that fixes the amount that we're going to spend. The other thing that you do is every Medicaid patient gets a medical home. There's really good data that many people misuse emergency rooms because they don't either have a regular physician or because they fail to take their medication in a timely manner, so they have complications. So what you do with a medical home is you identify those patients who are the most frequent utilizer of services. You provide to them case managers who assure they keep their appointments. You do things to make sure they take their medication when they need to take their medication. And so you reduce unnecessary ER visits, unnecessary hospitalization, and unnecessary medical utilization. And what that does is it drives down the overall cost of health care. I think it's important to understand with Medicaid, if we are successful, it's not that Medicaid is suddenly going to cost substantially less money. It's not. We already have a bare bones Medicaid program. What we hope to do is do two things. Number one, we hope to slow the rate of growth and make the rate of growth dependent on the number of people who are enrolled. And even more importantly, we hope to get high quality, better outcomes and predictable care for all the citizens.
We want to thank you for being here with us today, and thank you for all the hard work that you put in to Medicaid and public health. Our guest has been Dr. Don Williamson, Public Health Officer for Alabama. Stay tuned. You're watching The V. The V team will be right back.
The V is sponsored by Ginger Barbie, attorney at law. And MediaWorks Communications, video production services for all your video production needs.
I teach. I touch the future. I am AEA.
I keep the school clean every day for your children. I am AEA.
Congratulations on your scholarship. I help children make choices for college and careers. I am AEA.
We are AEA.
What is Mike Hubbard hiding? Mike Hubbard is hiding thousands of dollars he secretly took from the teachers union, known as the AEA, and deposited into his hidden foundation. Just recently, one of Hubbard's staffers blew the whistle and released the names of his donors to a watchdog group. The Mike Hubbard who accuses and bashes anyone he suspects of taking AEA money is the same Mike Hubbard who took thousands from AEA and hid it in a secret foundation. What else is hypocrite Mike Hubbard hiding?
Welcome back to the voice of Alabama politics. We're joined by Lyndon Baines Johnson.
Yeah, on prednisone.
Good to have you, Jack.
Thank
It's
you,
always
Bill.
good to have a Texan on the set.
You know,
Well.
isn't Don Williamson just one of the best public
He's-
servants you
he's a
know?
principal
Well, he
fellow.
knows the facts and figures, and he's not terribly boring when he says it. So that's certainly qualified for the job.
Well, we need good public servants. Speaking of not so hot public servants, there's a group out there called the Foundation for Limited Government that has released a pledge, an anti-corruption pledge. They're challenging lawmakers to sign it. They've got an ad running around the state. Let's take a look at the ad real quick.
When someone steals your hard-earned money, it's a crime. Doesn't matter if it's a pickpocket or a politician. And in Alabama, the politicians are taking advantage of us every day. Corruption, pay to play, backroom deals. They're getting rich while our families suffer. Now the legislative leadership in Montgomery is blocking real ethics reform. How long are we going to let them get away with it? Call your state legislators. Tell them to clean up Montgomery and sign the anti-corruption pledge.
That's a powerful ad, don't you think?
I would think. I mean, yeah, and I think you've seen the response to this group. 20 or 30 of these folks signed it right out of the gate. It's gaining more signatures daily. It's picking up steam.
Well, given the environment of Alabama, of what's been going on for almost the past year, I would think that anybody that's putting their name on the ballot this time, particularly as a Republican, would be willing to sign that pledge.
And to keep up with it, go to alabamapledge.com, and they update the people who've signed the pledge and mailed them in. And you don't see as many incumbents on there as you might expect.
Well,
or
I've
not.
heard that Hubbard has told people don't sign it.
Well, that's the rumor around the state.
Pledge or
They're too busy
Don't sign
signing
the
plea
pledge.
agreements.
Don't
Or
sign
what?
don't sign the anti-corruption pledge.
Oh,
or
Right.
what? Something else?
Don't
Guilty
sign the
feet have
plea.
got no rhythm.
Don't sign
If
the
you look
plea
at the
agreement.
pledge, if you look at the pledge, what I've heard is that all 8 of the points were focus grouped and polled, and that they all polled in excess of 75%. Now, if you can't sign a pledge that 75% of the folks in your district want, maybe you have no business being in office to begin with.
Well,
I hadn't
John
seen it, but
Rice,
that-
who's the head of that deal, is a solid conservative. I mean, he's a Tea Party kind of guy. I mean, he's far right. I mean, this is not some left-wing organization trying to get folks to sign a pledge. This is real hardcore conservative stuff. I think it's a big deal. I'd like to see more people sign it.
And he hails from Lee County, as I recall. Is that correct?
That's true. He does hail
A
from Lee
lifer.
County.
Yeah.
I was just down there earlier this week getting to know the sheriff and the folks down there. They're very nice folks. Speaking,
How's that courthouse coming along, all that new decoration?
I think they're about ready for the new $100,000 worth of furniture. But
Talking about abuse of state money, that's just outrageous.
well, it is
I mean,
a
I'm sorry.
lot of furniture. There is another new website out last week called Mike Hubbard Exposed. He's not naked on there, but the facts about him are absolutely
That would be
there.
disgusting.
Yeah, there on the website. There's a series of articles that have been written that, that kind of
It lays out what
Yeah,
he's done. I thought it was
chronology of
very-
what's
I'm not
happened.
sure who has done that, but it's very well chronologically done and very well organized. And I mean, the proof is in the pudding. I mean, you cannot denounce any of those facts on that website. Whoever did that did a great job. So
Well,
hats off
it's a
to 'em.
powerful website. I didn't look and see who's sponsoring it. I know that they quoted alreporter.com. You know, we have that section of the site called Stealing the State House that chronicles a lot of the same things that are out there. But these hit pieces are really coming hard and fast, aren't they, Barron?
They are, and it's this system that they've set up. You know, when they ended the PAC-to-PAC bans, they instituted the system of private foundations, and so you see foundations playing a role they've never played in the state of Alabama before. And I think this MikeHubbardExposed.com is one of them. There's another one on another sitting rep that's running for Senate that's kind of out there like this. I think you're going to see more and more foundations playing.
And they don't like them if they're not their foundations. If they're
Right.
not ones that have been, put together by the leadership and some of their folks, and they're blasting these other ones. But they're the ones that started
the
this.
ethics reform in 2010 is disgraceful.
Well, that was-
Now a corporation that used to be limited to 500 per election cycle, which would mean primary, runoff, general, now can give an unlimited money to a candidate.
Well, they gave this new pay raise deal in the last couple of years, or we're going to repeal the pay raise. Alabama legislators make the highest amount of any red state in the country.
Yeah.
More than double almost any other southern state in the country.
It's
disgusting.
shocking.
41,000 a year, and Texas legislators make 7,200.
Yeah, that whole thing was a scam, and the way they set it up and the way they worded it to have people vote on it, the people or the people did not know. And there was like maybe a handful. I know only one senator that I know of for sure. Senator Harry Ann Smith is the only one that I know does not take her salary.
Well, Harry
That's
Ann's an
commendable.
independent. I think
Right.
she's declared her independence, and she's got a tough race on her hand, but I think that she's the type of person that you want to see in government in our state. I know you were talking about, they ran this hit piece on Jim McClendon trying to act like Jim's not a real Republican. I don't know how much more real Republican.
Well, I wouldn't. Jerry Fielding spent his life as a Democrat. He was a Democrat judge for years and years, and the first term he was elected in the state Senate, he's a Democrat. He just now became a Republican. How can he say McClendon is an Obama liberal? That's crazy.
Okay, well, wait a minute. Let's put the hay down where the goats can get it. The reason that Hubbard and his cronies are doing this is because Representative Jim McClendon used to be a part of the PAC and the leadership. He saw the light, he got smart, and he's turned against Mike Hubbard. So I don't know if they're necessarily for Fielding. They are vehemently opposed to McClendon because he doesn't drink the Kool-Aid anymore.
He strayed from the flock.
Yeah, he strayed from the flock.
Well,
That's
McClendon's
That's
an
what that's
honest,
about.
lifelong conservative from St. Clair County, and I think he is one of the best guys we've got out there. We got about a minute and a half left. Another hit piece. They did one on the teachers, and I call it the children, too. They are really coming after teachers and public education out there. They say it's the AA, but these people don't care anything about public education.
Now, I saw that ad begin sometime middle of last week, and I had been in North Carolina and Georgia, and I just thought it was deplorable how they tried to tie the Alabama AEA to the NEA and then talk about money they're taking and giving to Planned Parenthood. It just was...
And the AEA, Mabry wrote an op-ed piece about he has real concerns with Common Core. The NEA is a big Common Core proponent,
Right.
and so is the Republican leadership because the Business Council of Alabama embraced Common Core.
Right, that's an
So I
excellent
mean,
point.
it's just a circle of lies.
Yeah, really, the Business Council's in bed with Obama on the Common Core.
Yeah, well, and the Business Council stands to make billions of dollars. All these guys, Riley and them, not billions, but hundreds of thousands of dollars off Common Core implementation. We got about 30 seconds. I mean, are we just going to see hammered lies and more lies?
Yeah, you're going to see a lot of money spent, and a lot of it's going to be deceptive, and it's going to be difficult to figure out where it is. I would say, trust your gut instinct here. But if people that don't drink the Riley Hubbard Kool-Aid are getting beat up, be very skeptical, because to me that's why they're doing it.
Well, we're going to stay after them. You're watching The V, the voice of Alabama politics. You can catch us on ABC stations around the state and always at alreporter.com. Thanks for watching.